Like a lot of people today, at one point I suffered from quite severe clinical anxiety. While I was doing my doctorate and working 50 hours a week in school and also in the clinic or in the hospital seeing patients, I was also one of the few students to work 20 hours a week outside of that so that I didn't die in a massive heaping load of student debt. Now, unfortunately for me, I did really pay the price with my health because one of the issues that I ended up having was quite severe clinical anxiety, heart palpitations, and severe insomnia. Hey guys, I'm Dr. Alex Hein, board licensed doctor of acupuncture and traditional Chinese medicine, and author of the health book Master the Day. So let's get in and we'll talk about the roots and the branches of anxiety. When we look at, for example, all of these channels and all of these points, let's go back several thousand years to the doctors that invented this medicine. Everything fundamentally is about promoting what they call qi flow in these channels. I think a modern scientist would just say what that means is regulating your physiology. So when we talk about anxiety, yes, we can talk about these points. Yes, we can talk about all these exotic looking esoteric channels. But fundamentally, ancient doctors would describe in anxiety, where is the patient's qi going? And if you've ever experienced anxiety is a sort of vibraty, floaty, ascending sensation, with a panic attack being sort of the crescendo. So these ancient doctors noticed that anxiety causes a kind of floating or ascendy, ungrounded, shaky, trembly, dizzy sensation. So they say that it causes the qi to rise, as if the person's ungrounded or has lost their anchor. The problem that happens in chronic anxiety and chronic sort of nervous system dysregulation or chronic adrenal problems is that the actual physiological anchor that allows your body to regulate itself and come down is sort of broken. Why am I having this so chronically now? That question is the important question because why you get sick is very different from why you stay sick. And in the case of chronic adrenal stress like this, very commonly people get sick because the physiological mechanisms that are normally there to prevent this sort of hyperarousal all the time, basically they've been compromised. From our point of view, the root cause is that anchoring effect, and the branch is just this constant feeling of anxiety or feeling too revved up or ungrounded. Now in conventional medicine, this would be called an issue with your HPA axis, the hypothalamic pituitary adrenal axis. So the interface between your brain and your adrenals. And everything in between can go wrong. But from my point of view, if you're having severe clinical anxiety, you can't sleep, you're having arrhythmias, you're having a fast heart rate, you have to primarily fix the HPA axis. Now, what are some of the most common herbs and formulas we use in traditional Chinese medicine? For example, the ones that I discussed that I took for a long time and will take as needed. The number one herb that is most commonly used is an herb called rogui. Rogui is the bark of cinnamon. This is most commonly the herb in high dose I use to get people off beta blockers for arrhythmias or AFib. Rogui, we say, is stronger at connecting heart and kidney. Now, what that weird diagnosis means is most often when people have heart and kidney not communicating, it's like a chronic adrenal stress, insomnia sort of pattern, anxiety and panic attacks. Rogui is very, very effective for treating that chronically revved up response where you feel on edge, you feel shaky, you feel trembly. There's always some kind of heart involvement, fast heart rate, arrhythmias, tight chest, that kind of thing. Number two are two minerals, longu, literally means dragon bone, and muli, oyster shell. So longu was originally probably thought to be dinosaur bone because these are originally fossilized bones that were used. Longu is actually, true longu is mineralized bone from fossils. This is like a mineral supplement using longu and muli, and they have a highly sedative quality to them. So there's a famous formula called guizhi jia longu muli tang. Guizhi, the cinnamon twig, with longu muli formula. And this is one of the famous formulas used for thousands of years for insomnia, with often that cardiac involvement of the nervous system being dysregulated. Those combined are two very, very effective sedative formulas. Another famous herb that you've probably heard in my videos is renshen or ginseng. Now, while renshen in Chinese medicine most often is in formulas for digestion, and it is an herb that we say tonifies qi, a certain percentage of the population will notice a significant pickup in energy after 2 to 3 weeks taking a renshen formula. But there's another interesting benefit. When you look at the clinical research on ginseng, a lot of it focuses on the HPA axis regulating effect. So it is very good at regulating the chronically high cortisol levels that come from the chronic stressors that people can have. Renshen formulas while they may be prescribed for digestive problems, secondarily have an amazing effect on regulating the chronically dysregulated nervous system. And then the final herb here is Fuling or Fushen. What's unique about Poria is that, like many of these Chinese herbs, their benefits are multifactorial. So for example, the famous formulas using Fuling are actually not for anxiety, they're for digestion bloating. There's one called Liu Junzitang, 6 Gentlemen Decoction, which is sort of a famous low-level formula just for bloating and food allergies and low appetite and that kind of thing. But Fuling in research also has another secondary benefit, which is how it's often used for anxiety and palpitations. Fuling actually works on serotonin in the brain and in the gut. And if you know yourself or others who've been on a certain class of antidepressants called SSRIs, they are one of the physiological pathways. One neurotransmitter they work on is also serotonin. So there's that shared root of treating digestion and also treating depression or anxiety. Now, the million-dollar question is, of course, how do I know what my anxiety is coming from? Whether it's east or west, properly diagnosing the root of the anxiety or depression determines the efficacy of the treatment helping you. Well, I actually did a live hour-long workshop on the lost Chinese practices that are quietly helping people conquer anxiety and insomnia. It's the first link right below this video. And in the video, the workshop, we actually go through 5 or 6 Chinese medicine practices that you can use to improve the symptoms of anxiety or insomnia or quote-unquote adrenal fatigue. And then we go into some more specifics about really what I would recommend doing on a day-to-day basis to help improve. And these aren't really things you would hear in conventional medicine. You'll mostly just hear take anti-anxiety medication, Xanax, sleeping pills, and that's kind of all they've got for you. And that's see you in 6 months or a year. And then if you still have those symptoms, you'll still be on those medications. So if you want to hear a different approach, just go download that workshop. First link right below this video where we dive in a little bit deeper. So the overall treatment approach of taking these formulas of herbs, when I go into a high stress period where I'm anxious and I'm not sleeping well, what I'll do is I'll take a formula for about 3 to 4 weeks to regulate the nervous system and regulate the stress hormones. And the reason for that is that a lot like if you've ever been prescribed an antidepressant or anti-anxiety medication, your doctor will say, it takes 4 to 6 weeks for things to really significantly kick in. The first week or 2, you might feel weird, get some digestive upset, but then afterwards it will regulate itself, and then in a month or 2, you'll start to feel better. It's almost like every week we downshift the nervous system and the stress hormones 10%. Week 1, 10%. Week 2, 10%. Week 3, 10%. Week 4, 10%. Over a month or 2, there's a really significant change in that way. And the reason this is important is because if you have chronic anxiety symptoms or chronic depression symptoms or chronic sleeping problems, you're often looking at a dysregulated nervous system HP axis over years. This is not the kind of thing that's gone in 3 weeks from taking it easy. This is the kind of thing that you should stop coffee for a month to see how you feel. You should reduce your work hours for several months to let the engine cool down a little bit. And in that way, you are doing more of a root treatment of the root cause of the problem. Everything else you take is totally fine, whether it's an antidepressant or you take these formulas or you start going to the gym or you stop coffee, all those things are fine. But to fix it, if you've been in this nightmare for months or years, you need to figure out how to downshift that nervous system and the stress hormones so that this becomes a more permanent resolution. Now, finally, how long does it take? On average, if you have really significant symptoms of quote adrenal fatigue, to let the nervous system downshift and regulate those physiological pathways, this is often a 6-month to 2-year plus process. That's just what it takes. It often takes at least that time to put you into this mode, and it takes a long time if you don't seek any kind of medical treatment for the body, the nervous system, the hormones to begin regulating themselves again. And again, if you want to learn more of those practices and a bit of my story and what I used to actually overcome this, that was quite severe and quite scary, download the link right below, the first link below this video. It's for that workshop. Workshop's an hour long, and we go into the half a dozen so practices from traditional Chinese medicine that are kind of like lost practices from my point of view that will help you improve this anxiety and the insomnia and sort of the adrenal fatigue kind of pattern. And then don't forget, guys, I work with a limited number of new patients every month in my clinic in Los Angeles or virtually via telemedicine. If you want to reach out, just go to dralexheyne.com/clinic, or right below this video, we have the clinic phone number, email, and the direct booking link if you want to book a consult or a visit that way, and my staff will reach out to you from there. So don't forget, there's one other video that's linked right up here that has some other practices and some herbal formulas I didn't share that you can learn more about for anxiety too.